The ultrasound beam from a convex transducer is shaped like a wedge and similar to this yellow training aid. It is relatively long from front to rear, but very narrow from side to side. The ultrasound beam in the patient's body is similar to this laser light line. It is relatively long from front to rear, but very narrow from side to side. The only thing you see on the ultrasound screen is what lies inside of the ultrasound beam. In this case, part of the stomach. To see more of the stomach, you must use the transducer to move the ultrasound beam. Your movements of the ultrasound beam must be slow, small, fine, rhythmic movements. You must give the ultrasound transducer time to send out a beam and receive the reflections in order for the ultrasound machine to construct an image. The most common mistake of beginners is moving too fast for the ultrasound machine to receive reflected return and construct an image. The transducer has an index indicator which indicates direction of the ultrasound beam. I will use a red pointer attached to the transducer to help you see the direction of the index indicator. In abdominal ultrasound, there is a corresponding index indicator on the ultrasound screen to help give direction to the image. The index indicator is always on the left side of the screen in abdominal ultrasound. The sagittal plane is any longitudinal or long axis plane of the patient's body stretching from the patient's head to the tail. Use the abdominal graphic included with this DVD to copy my movements. In abdominal ultrasound, use the ventral midline sagittal plane to view organs like the liver. Stomach. Urinary bladder. And prostate. Usually you will place the transducer in the left or right lateral sagittal plane to view the kidneys or adrenals. Occasionally it may be preferable to place the transducer along the left or right ventral sagittal plane to view kidneys or adrenals. To standardize images, the index indicator will always point toward the patient's head in a sagittal plane. The transverse plane is a cross-section of the patient's body. To obtain a transverse view of the stomach, rotate the transducer 90 degrees counterclockwise from the sagittal plane. When the transverse exam is completed, rotate 90 degrees clockwise back to a sagittal plane. In this form of movement, the transducer's point of contact with the patient's body changes without breaking contact with the skin. Use the abdominal graphic included with this DVD to copy my movements. Begin at the stomach with the transducer in the sagittal plane. Slide from the stomach cranially toward the liver, or slide caudally toward the urinary bladder. Return to the stomach and slide toward the patient's right side, or reverse direction and slide toward the patient's left side. Note that all directions and instructions are given in relation to the transducer's movement on the patient's body. Move to the patient's left or right, not your left or right. Angling is a forward to rearward movement of the transducer along the plane of the transducer index and from a point of fixation. The transducer's point of contact on the patient's body does not change. The most common time to angle is when looking under the ribs to visualize the liver or gallbladder, or under the pelvis to visualize the prostate or urethra. From the sagittal position, when you angle cranially, note that it is the ultrasound beam that moves cranially. Place your free hand over most of the liver and gallbladder of your abdominal graphic to simulate the rib cage. Place your transducer over the cranial stomach and angle cranially under the ribs to see the liver. Note, if you angle caudally, it is the ultrasound beam that moves caudally, so that you can see structures caudal to the stomach. Return the transducer to a perpendicular sagittal position over the stomach and rotate counterclockwise to the transverse position. From here, you can angle to the patient's right or angle to the patient's left. Fanning is a side-to-side movement of the transducer from a point of fixation. The transducer's point of contact on the patient's body does not change. In a sagittal position over the stomach, you can fan to the patient's right side. Note that it is the ultrasound beam that is moving to the patient's right. You can also reverse the direction and fan to the patient's left side. Return the transducer to a perpendicular sagittal position over the stomach and rotate to a transverse position. From the transverse position, you can fan cranially toward the liver or fan caudally. In ultrasound, rotation is a partial circular movement from a point of fixation. The transducer's point of contact on the patient's body does not change. The most common form of rotation is a 90-degree counterclockwise movement from a sagittal plane to a transverse plane, and then reversing clockwise back to a sagittal plane. Many organs of the body are lined up in the sagittal and transverse planes of the patient's body. Some organs, like the spleen and intestines, are not. With some organs, like the gallbladder, you may need to rotate off sagittal, or just enough to line the ultrasound beam up with the long or short axis of the organ. Sliding is the only form of transducer movement in which the transducer's point of contact with the patient's body changes. Angling is a forward or rearward movement of the transducer along the plane of the transducer index and from a point of fixation. Fanning is a side-to-side movement of the transducer from a point of fixation. Rotation is a circular movement of the transducer from a point of fixation. Most commonly, rotation is from a sagittal to a transverse plane and back to sagittal. Sometimes you must rotate just enough off sagittal to line up the ultrasound beam with an organ being imaged. Try not to combine forms of transducer movement, like sliding and fanning at the same time. Image drift is a common mistake that everyone makes. The image you want to study is centered on the ultrasound screen and then slowly begins to drift off the screen. Image drift occurs because you are unintentionally moving the transducer. Most people do one or more of the following movements. Positional image drift occurs most when the operator tries to hold the transducer without touching the patient's body with their transducer hand. I would like the stomach to remain at the green arrow on the ultrasound screen. While studying the ultrasound screen, the transducer hand begins to drift away from the point of contact. This movement is so gradual the operator does not feel it happening. Watch how far I must move the transducer to return to the original view of the stomach. I would like the stomach to remain at the green arrow on the ultrasound screen. For much of the ultrasound examination, the transducer hand is held in an unnatural position with the wrist extended. Once the organ of interest is located and centered on the ultrasound screen, most people relax. The wrist begins to relax to a more natural position. The angle of the transducer changes and the image begins to drift. Watch how far I must angle the transducer to return to the original view of the stomach. I would like the stomach to remain at the green arrow on the ultrasound screen. For much of the ultrasound examination, the transducer hand is held in an unnatural position with the wrist extended. Once the organ of interest is located and centered on the ultrasound screen, most people relax. The wrist begins to relax to a more natural position. The transducer slowly rotates, and the image begins to drift. Watch how far I must rotate the transducer to return to the original view of the stomach. Image drift is a common mistake everyone has to learn to correct. The sooner you learn to prevent image drift, the less frustrated you will be. If the image is drifting, it is because you are unintentionally moving the transducer. The best way to prevent image drift is to anchor your little finger to the patient's body, and then anchor the transducer to your little finger. You can anchor the edge of your transducer hand to the patient's body. If possible, lay your forearm on the patient's body as well. After dousing the patient with alcohol and then applying cold ultrasound gel, the warmth of the contact of your hand and forearm are soothing to the patient. If possible, you may also rest your forearm or elbow on the ultrasound cushion or exam table. If you're using an alternative grip, anchor the index finger to the patient's body, and then anchor the transducer to the index finger.